Good afternoon, everyone. My paper is on the outcome of corneal compression sutures for acute hydrops in keratoconus. Acute hydrops is a debilitating complication of corneal ectatic disorders characterized by corneal edema and symptoms like pain, photophobia, and defective vision. The conservative management of acute corneal hydrops takes a long time for resolution, and thus this may affect the patient's quality of life. When surgical modalities like compression sutures were combined with intracameral injection of air or gas tamponade is done, this helps in quicker resolution of edema and symptoms. The internal tamponade is provided by air or gas, as well as the external tamponade is provided by the compression sutures. Thus, the objective of my study is to describe the outcome of corneal compression sutures in hastening the resolution of corneal edema due to acute hydrops in keratoconus. Methodology. This was a retrospective case analysis which included the electronic medical records of 6 patients who developed acute hydrops secondary to keratoconus and presented to our tertiary care center between September 2022 and May 2025. Preoperatively, the corneal edema was evaluated using slit lamp photography images, measuring the uncorrected and best corrected visual acuity of the patients, and the central corneal thickness in microns was measured using anterior segment optical coherence tomography. Post-procedure, the improvement in edema was evaluated using the same parameters, as well as the time taken for edema resolution and symptomatic improvement was also measured. All the patients were initially treated with conservative methods, following which no satisfactory treatment outcome was observed, and then they were all taken for compression sutures. This was the surgical technique. Through the paracentesis, air is injected into the anterior chamber to delineate the Descemet's membrane tear, and perpendicular to the tear, partial thickness corneal compression sutures were taken. On tightening the sutures, on-table intraoperative egress of fluid was noted, and then it was marked. All the sutures were made tight, and then all the sutures were buried. Again, air was injected into the AC, kept for 20 minutes. Minimal air was left behind, and then BCL was placed. Results. The mean time for symptomatic relief and the mean time taken for edema resolution was found to be 1 day, and mean lines of improvement in best corrected visual acuity in a mean time period of 1 month post-operative was found to be 1 line in logMAR scale. The mean time follow-up for the patients were 1.5 months. Sutures were removed in all the patients as and when it got loosened. Results. The mean uncorrected visual acuity improved from 2.083 logMAR to 1.317, and best corrected visual acuity improved from 2.083 to 1.117. Mean central corneal thickness in microns measured using ASO-CT improved from 655.5 microns to 414.67 microns. These are a few clinical photographs. The first preoperative ASO-CT image shows significant corneal edema and intrastromal cleft, which can be seen reduced in the post-operative day 5 image. Below is a slit lamp photography image of the same patient, one of our patients under study. Discussion. Acute hydrops is a self-limiting disorder which in many cases resolves by observation alone, but this, as well as the traditional methods, takes a long time for resolution, and this affects the patient's quality of life badly. With the application of corneal compression sutures combined with intracameral air injection, faster resolution of corneal edema is observed, and also early quicker symptomatic relief is also observed. Probably, the complications of long-standing edema like corneal neovascularization as well as scarring might also be reduced, and this helps in early visual rehabilitation and provides better quality of life for the patients. A few studies have been done previously on the outcome of commonly used procedures for acute hydrops management, and out of them, in a study by Sunita Chaurase et al. In 2022, using modified partial thickness compression sutures and minimal intracameral air injection, the mean time for resolution was found to be 1 day, and no complications were found. Similarly, in our study, using the same intervention, the mean time taken for resolution of edema and symptoms was also found to be 1 day, and no complications were found. Residual corneal scarring was invariably present in all the patients, and they were all visually rehabilitated either with spectacles or scleral contact lenses or penetrating keratoplasty. Limitations of our study. This is a retrospective case study, and also the sample size is small. Thus, we can conclude that corneal compression sutures are a safe and effective modality to treat acute hydrops and helps in early resolution of corneal edema, and thus this can widely be employed with a good surgical practice and expertise. These are my references, and thank you.
Your outcome is a dictum.
Sir.
We have already accepted that.
Yes, sir.
We don't need a study to come and prove it. I would have been happy if you have done that study with a balanced approach. Like the downside you are not telling. You are saying hydrops gets things better.
Yes, sir.
But I'll tell you what all it will get bad. The compression sutures might worsen the astigmatism.
Yes, sir.
Compression sutures might create more suture-related issues in that already sick cornea. Certain times a compression suture might come to a level where you can't even put a PCL over it.
Yeah.
Okay, so those downsides also you should say,
Yes, sir.
and then say it's a valid approach. You should never say none. Your slide shows complications none.
Yes, sir.
It's as if like you expected endophthalmitis in all these cases and none happened. That kind of result you should not bring out.
Okay.
Even the nuanced ones, even the layered ones, you should bring it.
Okay, sir.
Okay.
For any of these patients, did you go ahead and remove these sutures?
Yes, ma'am. All
What
the
was the time
sutures were
duration?
on loosening during follow-up visits. It was all removed. And approximately in a duration of 1.5 months, all the patients had their sutures removed.
In case of recurrence of hydrops, do you again place the sutures?
In one of our patients, we had to do the surgery twice.
And what was the suture material used?
Tensor or nylon, ma'am.
Tensor nylon,
Yes, sir.
not silk.
No, sir. It was tensor or nylon, sir.
Needle.
Needle size, I don't precisely remember, sir. I don't.
Needle you should know, no? 3/4 of a cycle or 1/3 or something, you got.
Uh,
Spatula needle, micro point.
I
That
don't.
will ask you in exams. Please remember.
Sure, sir.
If you see tell tensor nylon, no, okay, will not leave you.
Okay, sir.
You must tell what's the curvature of the needle,
Okay, sir.
3/8 of a circle, something you must tell.
Uh,
And spatulated, micro point. Then only can pass through the cornea, man.
okay, sir.
You cannot use a round body needle, know that?
I'll see to that, sir.
Round body needles are for your intestines and all, mucous membranes. Have you ever tried a round body needle to put a corneal suture?
No, sir.
Go and try. We'll see.
Wait.
Okay, last question. Suppose silk suture is there.
Yes, sir.
This is for exam purpose. And nylon suture is there. You have put a knot.
Yes, sir. Okay.
After suturing, you have to put a knot, no?
Yes, sir.
You have to cut the suture, in which case near the knot, in which case away from knot.
For external procedures,
Then
Uh,
you tell me silk or nylon, that's all. Silk suture I put
yes, sir.
near the close the knot.
Okay, sir.
Or nylon suture I have to close the knot. That's all. cutting.
Nylon should be cut closer to the.
So that it can get released and everything can open. Understand? Please remember, nylon to be left something.
Sir.
Silk can be cut very close.
Okay,
You
sir.
know one word is called memory. Have you heard about it? Sutures have got some memory or
Yes,
something.
sir.
Remember like this.
Yes, sir.
The silk has got very good memory. It will not leave
Okay, sir.
its friend, other bend.
Okay.
Whereas nylon can easily throw it out.
Okay, sir.
That's called memory of the suture.
Sir.
Okay.
Sir.
These also Viva type of questions.
Okay,
That's
sir.
why I'm asking. Okay. Thank you.
Thank you, sir.